Hello, and welcome to our online training on stress management. My name is Karen DeLuhash, and I'm a project director for CARDIA. On behalf of the California Primary Care Association and CARDIA, we are pleased that you have selected this module to support your professional development. CARDIA is a nonprofit, mission-driven organization with a principal team of committed and passionate staff. We've dedicated our careers to helping health and human service providers offer their best to the patients they serve. You may be aware that CPCA is offering this training as part of their Patient-Centered Health Home Recognition Program. This initiative is designed to support the efforts of member clinics as they move toward achieving National Committee for Quality Assurance recognition. CPCA has made a commitment to support community clinic and health centers in California to become a patient-centered health home. For more information, visit their website at www.cpca.org. This training module offers an opportunity to talk about stress during times of change. Expanding and improving our healthcare service delivery has become a primary goal for many healthcare organizations across the country. Implementing this goal will take a transformational approach that will bring about major changes in how we effectively and efficiently provide high-quality, patient-centered healthcare to our communities. If you haven't already accessed the session in this series on change management, I encourage you to do so soon. An important component of how we effectively manage this changing environment includes how we manage the stress that results from changing our systems, the changing roles and responsibilities of our staff, and often changes in how we approach our patients. This session will focus on how we might identify the potential stressful situations that result in the day-to-day process of making change happen. This potential stress may impact our individual staff members as well as having an impact on our clinic teams and how well they function. How we approach the concept of stress is addressed in this quote from Maureen Killoran. Ms. Killoran once said, "Stress is not what happens to us, it's our response to what happens. And the response is something we can choose." As you complete this brief outline session on stress management, I encourage you to think about the situations in your work life that have an impact on your stress level. Ask yourself, what is happening that is causing me stress? During these times of change and transition in healthcare and in other parts of our lives, stress can have a major impact on our health, our relationships, and the choices we make. This session is designed to give you an opportunity to reflect on the stressors in your life. What causes you to have stress? And how do you react to those stressors? And some practical strategies for keeping healthy in your mind, your body, and your spirit. As a result of your exploration within your own stress management approach, you will also have an opportunity to reflect upon your work team. Many of the stressful situations in our work life can best be addressed as a team with your coworkers and supervisors. What stresses you may also be a source of stress for others. So identifying strategies that can support you and can be supportive of others in your team will ensure a more effective and efficient work team and will ultimately improve your work environment as well as ensure high quality and consistent service delivery for your patients. So before we move to the next slide, take a deep breath and join me in a reflective walk that is focused on how can I choose my response to the stress in my life, and especially in my work life. Before we begin, I want to quickly review some suggestions for this learning activity. There are 4 handouts available for download that can be used during this session. Handout number 1 is intended to help you assess and rate your current level of stress that will give you a benchmark along with more specific potential sources of stress. This handout is titled Rating Personal Stress Levels and Sources. As you can see, this handout provides a rating scale and a place to list the sources of stress that relate to your experience. Handout number 2 is a self-assessment tool designed to explore how an individual responds to stressful situations. It is titled Stress Style Test and was created by Daniel Goleman, PhD. This handout provides information about where you can download the Stress Style Test. For this session, we have adapted it into a handout for your convenience. The third handout is titled Coping Index. Again, this handout is a simplified guide that provides a list of qualities and activities that can enhance coping ability and that may lead to a healthier lifestyle. Both of these self-assessment tools will be referred to during this session, and you may want to print them before you begin. The fourth handout is titled Stress Management Plan. This handout offers some basic questions and a template to help guide an overall stress management plan as an individual or as a care team or any other work team. An overview of this session is reflected in the learning objectives. The intent of this session is to give you an opportunity to 1. Describe potential personal stressors in your work setting. Not everyone is stressed by the same things, and it's important to be able to tell yourself just what is personally stressing you currently. For example, a personal work stress might be around new job responsibilities or adapting to a new electronic health record program or other clinic system changes that are intended to improve the service delivery to patients. Number 2, identify places you can and cannot control those stressors. For example, you cannot control the stress that comes from that new electronic health record program, but you can control your approach to this change and how taking the change one day at a time just may improve your overall stress responses. Number 3, list 2 mental and/or physical ways to cope with stress. We will be talking more about how each of us responds to stress differently, and each of us must find our own methods and activities that help us cope with stress. To accomplish these learning objectives, we will first provide an overview of stress. What are various potential sources of stress, and especially how it relates to our work? We will refer to and encourage you to take brief and easy assessment tools that can help explore our personal stress response style and the resilience factors that we have that can strengthen our coping ability. We will identify strategies, specific activities that can be used in the moment at work, before and after our work hours, and especially as we make plans for change and transition within our work and care teams. As we close the session, we will focus on making a stress management plan, both as individuals and as teams. We will provide a brief interview with the clinic manager who will discuss how specific strategies helped his team and himself facilitate a stressful system change situation into a more productive and problem-solving process. And finally, we will provide a quick review of our sources and resources used in planning this session. Let's begin with an overview of the potential stress in our workplace setting and a way to identify some of the potential sources of stress for individuals and for work teams. Think for a moment about what is happening in our healthcare settings as we move nationally to a more efficient, high-quality, patient-centered service delivery system. Our systems are changing, such as how patients make appointments, clinic flow processes, and billing and reimbursement processes. Each of these are crucial changes to successful healthcare delivery. Improvements in technology will continue to be evolving every day. Our expanded use of electronic health records, telemedicine, the use of smartphone apps, and other forms of technology will continue to impact how we provide our clinical services. Our working relationships with patients, colleagues, and work or care team members remain the cornerstone of our mission. But these changes in systems and technology will impact our own professional roles and responsibilities. All of this change is to improve service delivery, to be sustainable in the future, and to provide the best health care for our patients that will ensure more healthy outcomes for all people in our communities. But all of these changes will have an impact on our levels of stress. We do know that stress is an everyday fact of life, especially in our work life. And we do know that this stress may come from a variety of sources. One way that we can look at and identify basic sources of stress can be described as looking for clusters or categories of stressors. Reviewing these sources of stress in categories, we can better identify some of the general sources of what might cause you stress at work. For instance, you may be experiencing many systems changing in your clinic setting, maybe patient scheduling changes or new insurance billing and reimbursement procedures. When we identify the general categories of your stress, we can explore the possibility that these sources may be the same stressors that your coworkers may be experiencing. If so, work strategies can address these stressors using a team problem-solving approach. You may be relieved. It isn't just you. First, let's identify the potential source of stress that can occur in our healthcare setting. It's always important to reflect and really identify where is my stress coming from. You may ask yourself, what was the trigger that set off my stress this time? Identifying the where is the beginning of the process of deciding what to do about it. The following 4 categories of potential stress sources were adapted from the text, the Relaxation and Stress Reduction Workbook, as referenced at the end of this presentation. We have chosen these 4 categories or clusters to help structure a model to identify the specific sources of stress and then to explore specific strategies to help with problem solving as an individual or as a group or team. We will briefly explore these categories individually. The environment around you can have a major impact on your stress level. The environment stressors at work often include the system changes or your facility changes, such as remodeling or rearranging workspace. These stressors or triggers can include new or upgrades in your computer system or electronic health records, a revised patient scheduling change that is moving your process to the open access or same-day appointments. This is a system change that has an impact on staff and on patients. Or the increase in data gathering that focuses on productivity or other new benchmarks that are directed at improving our systems and service delivery. What other changes are part of your work environment? If you'd like, you could pause this recording to take a moment to think of other environmental stressors that are happening in your workplace. The second cluster of potential sources of stress is called the social stressors, and they are related to our interpersonal interactions and relationships. What specific social stressors are having an impact on you? These may include interactions with patients who are angry with you, or maybe they are just angry with a system change that you are also frustrated with. For instance, that patient scheduling change that is happening and does not feel very user-friendly. Maybe your stress is working with others on your multidisciplinary team. Maybe roles and responsibilities are changing and confusing. The third cluster of potential stressors are the physiological sources, involving more of how we feel physically and how our bodies are responding. These physiological factors can include aging, illness, or accidents, or just plain physical symptoms, such as headaches or a stomach upset, that may be caused by anxiety and stress. What might be your physiological sources of stress? How is your physical health? What physical symptoms do you experience that cause stress? Think about your back, your feet, your ability to do the physical activities that you may have enjoyed in the past. How is age a factor for you? And how do you feel? Have you experienced a recent accident or an illness? Our physical well-being has a major influence on how we cope with stress in our lives. And finally, the fourth cluster of potential sources of stressors are our thoughts, the psychological aspect of stressful thoughts. How does our brain respond to the complex changes in our environment, our body, and our relationships? What are the first thoughts that come to your mind when a stressful incident happens? Are these thoughts positive, a reaction of strength, or feeling confident that you can cope? Or are your thoughts more hesitant and worrisome or fearful? Maybe it depends on what the incident happens to be. Maybe you're saying, well, it depends. And that's what we'll be addressing as we move through this module on stress management. In summary, we know that stress is an everyday fact of life. Change and transitions happen in our personal lives and in our work setting. We know that the systems in our environment, the interpersonal interactions we have with patients and colleagues, how we feel physically, and especially our thought responses, all of these play a part in our ability to cope with stress. We know that in the healthcare setting, we are presented with changes in the structure of our service delivery systems. Our roles are changing. Certainly technology has had an impact on how we perform our jobs, and relationships in the healthcare field are ever changing. Intertwined with these workplace changes, our lives and day-to-day living continues to have an impact on our stress level and our coping strategies. But before we move to how we respond to these stressors, I do want to address briefly the benefits of stress. As healthcare providers and workers, I'm certain that you have a sense of the benefits that come from experiencing stress. First, stress helps us deal with threats of danger. Some of the early descriptions of stress are related to the physical signs or biochemical changes. These descriptions of fight or flight have been described as when our bodies alert us to a stressful situation or give us a quick emergency response. These are very beneficial indicators, especially when we work in the healthcare setting. Next, stress can also offer us a sign that a situation is not healthy. A headache or a stomach ache can give us a signal that something could be stressing us that we hadn't considered stressful yet. Also, stress can be a motivator. Many people describe stress as providing them with that quick burst of energy or adrenaline that helps them get work done. In my years as a clinic manager, I remember some staff saying at the end of a busy clinic day, "That was a great day." Even though it was hectic at times, it felt good to work as a team and see all of our patients and get out on time. So what are the benefits of stress that you feel and that are helpful for you? Take note, part of this stress management activity is identifying the good stress or positive stress level as well as the bad, unhealthy stress. We do not go into great detail about positive stress sources during this session. Mostly they are individually relevant, but they can be a motivator. So again, we're reminded that stress sources are different for each of us who work in the healthcare environment. As healthcare workers, you are also aware of the cost to high levels and persistent levels of stress. These can include an impact to your health and your overall joy in life, an impact to your relationships, both on the job and your personal relationships. And finally, they can impact efficiency at your job, but also in your personal life. Remember what Maureen Killoran said, stress. It is our response to what happens. As a quick review, we do know about stress and how it relates to our health. Our response to stress can increase our risk to a variety of health issues such as high blood pressure and heart disease, increased symptoms of asthma, increased weight and obesity, and diabetes. Other symptoms that are related to stress are headaches, depression and anxiety, gastrointestinal problems, and other health issues, including an impact on aging and life expectancy for an individual. Reviewing these potential outcomes of stress is the reason we wanted to make sure we included stress management in our overall discussion of change management. It's important for our care teams, including administrators, managers, and all staff, that we make a specific goal to integrate a stress management plan in all work settings. It's time for the first activity that will provide you with an opportunity to rate your personal stress level at this moment. Given that we know also that stress management is a lifelong journey, I will ask you, how do you track or integrate your awareness about your day-to-day level of stress? I hope there are times in your life when you're mostly free from much stress, but there are other times when we all experience multiple challenges at work and in our personal lives. The goal of rating our stress level is to learn to monitor our stress triggers and to use our stress strategies as we need them. If we can monitor our level of stress daily, weekly, monthly, we can develop lifelong skills on how to manage and respond to the stress in our lives. This first activity is to help you rate just how are your stress levels at this time in your life, especially as it relates to your work setting. How would you rate your level of stress right now, in this moment, using a rating scale from 1 to 10? Number 1 means, I'm really not feeling stressed at all. At this moment, it's been a good day, and life at work is fine. Number 10 means, right now, I'm really stressed. I just found out our clinic is expanding our hours, and I'm worried that I'll have to work many extra hours. Or, you may actually be somewhere in between. This graphic is a demonstration of how to identify for yourself just how stressed are you. Yes, this task is similar to when we ask our patients how he or she might indicate a pain level. It helps us set a benchmark that can help us decide if we need to move to action. Visualize this graphic and identify the number that best reflects your current level of stress. Maybe it's a 5. Maybe you're somewhere in the middle. Remember this number as we move forward in this session's activities. Maybe some of the activities will offer you some insight into your stress management processes. Let's take a look at handout number 1. Please take a moment to quickly assess which of the 4 areas of potential stress sources are playing a part in your life today. Examples could be work environment, technology or systems changes, more data gathering, or social or interpersonal relationships with patients, colleagues, or changes in the multidisciplinary care teams that include role and responsibility changes. Also, our physiological changes that can include our age, recent accident or illness, or other physical symptoms. In other words, how strong do you feel right now as you perform your job? And finally, how do you respond psychologically? How strong and positive are your thought processes in responding to stress? What self-talk do you hear? Are there any other potential sources of stress in your work setting that don't fit into these categories? If so, please adapt this handout to fit your needs. The goal is to provide some structure to identify the sources of stress. Sometimes it takes an effort and some time to reflect and to get to the heart of the sources of stress. Before we move along, you may want to take a moment and refer to the handout Rating Personal Stress Levels and Sources. Once you identify your list of stressors, take a moment to consider which of these stressors are issues you can control. This may take a moment to ask yourself, how much control do I have in this situation? What can I do? Then take a look to see if there are other ones that you cannot control. What can I do to let go or to manage my stress for the issues that I have very little or no control over? For instance, if your stress is related to a systems change, like in the work environment category, that is out of your control, meaning it is going to happen, you may want to explore what piece of this change is in your control. This change may end up to be psychological or a thought category, or asking, how am I going to change my attitude or approach to this stress source? How you manage your response to these various issues may be different using different coping strategies. But also, if this stress is having an impact on your life, it may also have an impact on your work and also on your health. At this time, I encourage you to pause this recording and take a few moments to list the sources of stress that you've been thinking about during this module. List 2 or 3 on handout number 1. You may pause this recording now. Welcome back. So the next important question for this module is, how do you respond to stress? The answer is, how you respond to your stressful life experiences will determine the impact stress will have on your life and your health. So for the next portion of this session, I invite you to begin with your personal reflection. Reflect on how you typically respond to stress. Maybe you're free from stress at this exact moment, but this is a time to explore the last time you felt stress. Maybe you can do some reflecting on how you worked your way out of the past stressful time or event. This may be time you can reflect on that time and build your resilience for the future. The next 2 activities will be using the assessment tools in Handout 2 and Handout 3. You may want to make sure you have them available as we go through these slides. For this activity, think of a current stressful circumstance in your work life. Maybe using the activity number 1 handout that you completed that lists potential sources of the stress in your work life. Maybe stress is about the new system or technology that you're faced with and having to change the way you work. or because of our expanded focus on quality improvement processes and the collection of data or new deadlines. With these changes, you now have added or changed responsibilities. Or maybe the people with whom you work, your relationships. Are these having an impact on your work? Maybe it's your boss or those in leadership roles that are making decisions that impact your level of stress. Or maybe your clinic has moved to more primary care services and you're beginning to see patients that are more sick than those you saw before this change. Serving a new or expanded patient population can feel stressful because it challenges your professional skills and confidence. Once we identify the source of stress, we can then identify the signs or symptoms that result from that source. Again, let us use the example of systems change. Remember the example of a clinic that is upgrading the electronic health record process. One person may begin to have headaches and is exhausted at the end of every workday. These are signs and symptoms. Someone else may not have headaches, but is beginning to feel like, I just can't do this job anymore. And a third person may feel, wow, this is exciting. We're going to get so much great new data out of this new system. These signs may be positive or negative, and they are both very important to managing stress within managing change. I hope you were able a few moments ago to identify what causes you stress. In other words, what might trigger a stress response for you. Because this next step is to determine just how you respond. What are the signs that you experience when you're under stress? What are your symptoms? This next activity is designed to help you clarify just how you respond to the sources of your stress response style. There is no right or wrong way to respond to stress, but it is helpful to know your style so you can notice when stress is happening to you. See handout number 2, the Stress Style Test. This assessment test is short and easy to take, and we have included it in your handouts so it's easily available to you. This test can also be found on the website www.ceattc.org. The instructions are to imagine yourself in a recent stressful situation. When you're feeling anxious, what do you typically experience? Check all that apply. Again, if your answer to each question applies to you, then circle it. At the end, you will tally the numbers that are circled at the bottom of the page. Remember, these are just guides, just questions to help you assess. There may be other ways in which you respond when you're under stress. You may want to take a moment and pause to answer these 14 questions. This should take no more than 5 minutes and will offer you some information about some stress signs to watch for during your day. Sometimes we are under stress and we've not yet identified it as stress or acknowledged it yet. As you add these response points from this self-assessment, you will find that you respond to stressors that are 1, mostly in your mind, 2, mostly in your body, or 3, kind of a mixed body and mind response. You may think it depends on what the situation is. Some stressful situations may cause you to think, I just can't do this. But other stressful situations may cause more physical symptoms. That can be more subtle, such as a headache or a stomach ache. All of this information about signs or symptoms can help you identify which stress-reducing activity is best for you under various circumstances. These indicators can be helpful in selecting which activity you might want to choose to help relieve stress, in the moment or at the end of the day. So a quick review. Mind points, which mean you respond to stress more within your mind or in your thoughts that may distract you or cause worry or even hold back your decision making. Body points, which means you respond to stress more within your body. Your heart beats faster, or you feel jittery, or you may pace nervously. Or a combination of mind and body responses, which means a mixed style of responding to stress. First, if you respond to stress in your mind with thoughts of worry or anxiety, the best relaxation activity might be meditation, reading, creative imagery, or visualization. Also, crossword puzzles or other games such as chess or cards, knitting or sewing, carpentry, something that will engage your mind and your thoughts. How a person could use these relaxation activities at work might be to take a quick break in a quiet place to briefly meditate or visualize a more restful environment, or at lunch, reading, working on a puzzle, or playing cards, or some handcrafting like knitting. If you respond to stress through your body, some physical activity may be needed to break up the physical tension in your body. Some examples of activities might be aerobics, walking or running or biking, or swimming. But also other activities might be progressive relaxation, deep breathing, or yoga. How might someone use these relaxation activities at work? This person may want to take a quick break to walk around the block, or at lunch, go for a longer walk or a run. But at any time, a person can do some deep breathing, taking a few deep breaths that can make a difference in the moment. If you respond to stress through your body and your mind, you are more mixed in how you respond to stress. Any combination of mind and body activity might help. Or maybe a competitive sport, tennis, racquetball, softball, or baseball, or volleyball. The idea is to find the ways that you can choose to relax and reduce your level of stress. How can some of these activities apply to our workplace? Some colleagues have established after-work softball teams, or have arranged fun-run teams to help raise money for a specific community organization. Or maybe an annual team retreat that includes interactive games. But also, a work team can identify other simple stress reduction activities such as a place in the clinic for individuals to go for a moment of quiet and relaxation, or a group puzzle to work on in the lunch area. The types of activities need to be generated from the team, but must include both mind and body activities. Also, it's important to revisit this list of activities to include new staff who join the team. In summary, this assessment is a way to see if you respond more in your mind or in your body, or a combination of both. But it also encourages you to ask, how do the members of your work team respond to stress? Some people insist that running really helps work out their stress, a physical activity to relieve the tension in their body. But others may need an activity that relaxes the mind. They just want a quiet space that feels peaceful and relaxing. So we've talked about what may be the source of stress and how you respond to stress. Let's talk about what personal attributes you bring to your ability to cope with stress. This next activity will help you identify some of your attributes. For instance, your personal relationship resources, your qualities and behaviors that you already have in your life that provide you with resilience that can play into your stress management plan. With this coping index activity, we want to explore what helps us cope with stress. In other words, what strengths do we currently have that help us cope? These are factors that are already in place in our lives. Even when we're not under stress, they are part of our everyday life. In addition, we want to look at a few coping methods that we may be using that may not be as helpful as we think. Please take a look at your handout number 3, the Coping Index. For this activity, there are 15 questions. Your answers will offer you some ideas about the sources of coping and resilience factors that you bring to your reaction to stress. You will write down the number of points for each number that applies to you. At the end, you will tally these numbers for your total score. This activity should take no more than 5 minutes. Remember, these assessment tools are just brief questions to help you reflect and assess your own experience. There may be other factors in your life, ones not listed in this assessment tool, that build your strength and resilience when under stress. This is a good time to acknowledge these other factors. Sometimes we take them for granted, but in some ways they may be a great source of support that you really hadn't realized. Now, we encourage you to pause this recording, complete the assessment, and total your points. Welcome back. I hope you found this assessment questionnaire helpful. I found this activity interesting. Some of these factors I really had not considered a strength in a stress management plan, such as pursuing a hobby or attending a social activity at least once a week. Completing this activity also gave me a checklist. It gave me very specific activities that I can do regularly to help ensure my consistent awareness of my stress level and to maintain my commitment to my stress management plan. One additional factor that I thought of as I completed this instrument was if you have a supportive work environment. I might add 5 more points. We spend many of our hours at work, and the support of our supervisor and our coworkers can add a tremendous coping factor. Let's look at possible results and what they may indicate. Remember, this is only a tool for you to interpret what it means to you. 56 points or higher. This indicates a healthy stress index. You have good reserves for managing stress. 25 to 55 points. Your coping index is somewhat problematic. Some symptoms or maybe some illnesses could occur. 25 points or less. Stress or burnout may already be happening or are imminent. You may want to consider checking in with a health professional to discuss some of the indicators you've just reviewed. Remember one of our earlier slides at the beginning of this module? Stress is not what happens to us, it's our response to what happens. And response is something we can choose. This module on stress management is an opportunity for you to reflect on what responses you are choosing. Which brings us to exploring stress management planning. As we move through the last portion of this module, we want to begin identifying strategies that can be integrated into stress management planning. For our purpose in this module, we will refer primarily to the work setting, but on 2 levels. 1, what can you do to integrate effective strategies into your individual stress management plan? And 2, what might you include as a care team or your work team as part of a team stress management plan? Returning to our flow process of stress in the workplace, we have identified the source or multiple sources of stress. We've explored our responses to stress and the signs or symptoms that result from that source. And we have talked about the attributes you may already have in place that offer you resilience in coping with stress. The final step is to identify and implement strategies that can support individuals and the team. Which brings us to strategies. These can be activities or behaviors that can help reduce stress. In this section, we will briefly discuss individual strategies or activities that can be part of a stress management plan, and we will also identify some team strategies or activities that can be part of a stress management plan in your workplace. Some of these will overlap between individual and team approaches. Creativity is key to developing effective, relevant, stress-reducing strategies. Let's review some of the easy techniques that can help reduce stress in the moment, but also on an ongoing basis. How often have you used any of the following techniques? Breathing, focusing on your breathing, progressive relaxation, positive self-talk, meditation, visualization. There are many, many more, and your own exploration of what works for you is part of the stress management journey. Let's start with breathing, a basic necessity of life, and yet sometimes when we're under stress, we stop breathing or briefly hold our breath. So briefly, these breathing exercises are to increase awareness and promote relaxation. They're also a way to release tension and to stimulate alertness. An easy example is used by many people I've worked with over the years. When the day gets just a bit stressful, a person can take a few moments, less than 5 minutes, and sit quietly and take deep breaths, breathing in and slowly exhaling. For more information about these breathing techniques, you may refer to the Relaxation and Stress Reduction Workbook listed on the Sources and Resources slide at the end of this presentation, or numerous other books or online resources. Progressive relaxation is the gradual relaxation of muscles, which reduces your pulse rate and blood pressure, as well as decreasing perspiration and respiration rates. These techniques can help reduce the physiological tension within the body and hopefully reduce anxiety and stress. When these techniques are mastered, these deep muscle relaxation techniques can be used as part of a very effective personal stress management plan. Self-talk is an important strategy, and it addresses the source of stress that we talked about at the beginning of this module, the psychological stressor, or what we tell ourselves during times of stress. The goal is to eliminate irrational self-talk and to build positive or more rational self-talk. We want to eliminate the irrational self-talk such as, I really don't think I can do this. I just can't adjust to all this change. And we want to build more rational self-talk such as, I'll just relax and do the best I can. I can do this. I just need to try. Other good examples include coping self-talk. I will just take one step at a time. If I can just think calmly about this, I can get it done. Or reinforcing self-talk. Phew, that wasn't so bad. I'm really getting better at dealing with all this stress. Other exercises that help in the management of stress include meditation. Meditation is the practice of uncritically attempting to focus your attention on one thing at a time. There are many forms or adaptations of meditation, and again, with the purpose to focus your attention on one thing at a time, with the goal of releasing your thoughts of the day. Meditation for some people can be a very effective activity to reduce stress. An example at work could include finding a quiet place on a break or a lunch hour to practice a form of meditation. People who do this often report coming back to work feeling refreshed and ready to focus on their work. Other exercises that help in the management of stress include using visualization. Visualization is the practice of positive thinking by using your imagination. It can be used for various reasons, including stress reduction. Again, taking a quiet moment to visualize a restful, stress-free environment. So now, let's review some of the easy techniques that can help reduce stress as a multidisciplinary team. We know that strong, effective teams are crucial to the delivery of high-quality, consistent, efficient healthcare for our patients. There are several important elements that play into the development of an effective team stress management plan. There's the importance of leadership, the use of staff meetings, and that teams should set their own goals, and that members of each team can clarify and problem-solve specific challenges. But most important, that time for teams to celebrate and have fun together are part of the plan. There are many, many more ways teams can help reduce stress in the workplace, but let's review these a bit more closely. First, the leadership of an organization needs to acknowledge and confirm that a stress management plan is important and is an approved priority for each team. That includes approving time to address stress management issues. In healthcare settings, we see patients every day who are under a great deal of stress. It makes sense that the healthcare providers and all the staff who are part of the delivery of quality services need to be skilled in responding to these patients in a supportive, empathetic manner. To effectively respond to patients under stress means that staff need support in maintaining their personal stress, especially as it relates to work. During my years as a clinic manager and a director of clinical services, I learned that it was very important to lead by example, model my ability to cope with stress, and to recognize that stress was a part of the healthcare environment. We often used our staff meetings to integrate stress reduction activities into our overall problem-solving efforts. Which brings me to staff meetings. These meetings need to include a scheduled check-in time to identify the challenges that impact stress levels within the work setting. This staff meeting time can include a quick brainstorming activity that can focus on how can we reduce stress from a team perspective. Again, as a clinic manager, during our clinic staff meetings, we would schedule time to talk about the situations such as angry patients, what to do when certain areas in the clinic flow got backed up with patients waiting too long to be seen, and other patient or clinic system issues. Sometimes just talking about these situations as a team, staff members could see that maybe this was a system problem and not a staff problem. Various staff may offer suggestions or just offer support to staff who were feeling the stress. This does not need to take a long time. For the ultimate solutions, the issue can be delegated or scheduled time to make final decisions later. The time during staff meetings is to acknowledge the stress, offer support, identify next steps, and then move on. Teams should set their own goals related to how to establish a team stress management plan for their team. These goals will vary with different care teams or other work teams. The important part of this process is that members of each team can clarify and problem solve specific challenges. What is stressful to one person may not be stressful to others. Teams can identify a strategy that can utilize individual staff members' strengths and can support others. And the final note is it's very important for teams to celebrate and have fun together, especially in times of stress. As our healthcare agencies make these amazing changes in our healthcare service delivery, there will be many opportunities to celebrate and acknowledge all that's being accomplished to improve how we serve our patients. Having fun is a major stress reduction strategy. And finally, There are some general strategies that many people and teams find helpful. Gathering data as a team or as an individual can identify ongoing stress patterns. As a team, gathering data and using that data is an important part of improving systems. Even a simple task of keeping track of how often and which days the clinic ends on time and the staff leave on time can provide valuable information. Working over scheduled hours is a common issue and can cause stress for many people, both staff and managers. These inconsistent work hours can also be an indicator of inefficient work systems. Gathering data on the days when everyone leaves work on time, along with the days when the clinic runs over the schedule, can identify both successful and problematic patterns. As an individual, if someone who is under stress has a tendency to eat more food or eat less healthy food, keeping a food diary has often been suggested as a way to monitor behavior. Keeping an exercise diary is another common stress monitoring activity. Keeping a calendar and setting a schedule for both individual and team activities can help integrate the stress management plan and activities into a routine. We've listed various strategies or activities that an individual or a team can use to integrate stress management into their workday and workplace. We'd like to offer one example of how this planning can be integrated. Sometimes it's helpful to hear about a real situation where stress management examples can be identified and described. These last few moments of our stress management module will specifically focus on the application process of how strategies can be integrated into our everyday work setting. We have provided a template of simple questions to ask yourself and/or your colleagues. This template provides us with a format as we talk with our guest speaker. And this template also offers a few questions you might consider when you make or review your current stress management plan. What's important to you in your work setting? Describe or discuss your values and priorities. What is one current work-related goal? What are one or two stressful situations that activate or trigger a stressful response for you? What are one or two indicators or signs you see in yourself or within the team when the stress level increases? What are a couple of attributes or strengths that can contribute to you and to your team? And finally, what are one or two strategies or activities that might be helpful in this situation? Hello, Kyle. Thank you for meeting with us today to tell us about your Valley Community Health Clinic and one of the major changes that's been happening in your clinic.
Thank you for asking me, Karen. We have had several major changes, one of which was around how we provide access to our services. Our agency leadership team and our clinic staff recognized that we needed to be able to provide our patients and our growing community with quick and easier access to our services. To do so, we needed to move from our old patient scheduling system that had clinic appointments booked out about 2 weeks to a same-day appointment system. We knew this would be a challenge and would change how we interacted with our patients, but we also realized that we needed to reduce the barriers for patients. Our goal is to be able to schedule our patients as soon as they needed to come into the clinic, hopefully the same day they contact us or at a minimum by the next day.
It sounds like an important goal for your organization. With this major change coming, how did you prepare your staff? As the clinic manager, there must have been some concerns about the stress it might cause you and your staff.
Yes, I have had experience in other clinics when major changes were made, and I knew this would bring about a stressful period of time. So this time I decided to be prepared and make a plan both for myself and for my staff.
We've been talking during this training module about stress management planning. Tell us first, how did you make a plan for yourself? What's important for you in your work setting, and what was your personal goal as the manager of this change process?
First, what is really important to me as a manager is to set a work environment that welcomes comments and suggestions from all staff. I have realized that to prepare for change, especially when it has to do with people and systems, it is crucial that everyone is ready for some challenges early in the process. So my goal is to make this a team effort. If I have the team involved, it takes much of the stress off of me. The team helps me to address some of the challenges that appear during the change.
When you know that change is happening, what specific stress triggers are you aware of for yourself?
Personally, knowing that change is coming is exciting to me. I see change as a great opportunity to expand and improve our services. So that is a positive. That's a good stress, and it motivates me. But also, the technology within systems change can make me crazy, probably because much of it is out of my control. So I really have to work at recognizing and expecting that there will be challenges with the computer systems and how this new system will impact our patients until they get used to a new way of making clinic appointments.
How do you know when you're feeling crazy, and what are the signs that you experience?
Good question. I sometimes learn about my stress level from my staff. Someone will say, "Kyle, are you doing all right? You look a bit stressed today." Such comments tell me that my body language is reflecting my stress level. Also, I will know I'm stressed because by the end of the day, I feel exhausted.
So what do you do? What overall ongoing activities do you do to manage your stress?
Well, first, I tell my staff, especially one of my nurses, that I depend on them to tell me when I look stressed because sometimes I don't realize it myself. So I think having supportive and candid staff is very helpful. But I also make sure that work isn't all that I do in my life. I exercise, play soccer one evening a week, and really love to cook.
So you really seem to have a regular personal stress management plan. What about when things get really stressful? At the end of a really bad day, what do you do then?
Well, during these times when I know we are going through these major changes, I try to make sure I get home on time so I can go for a run and release some of the tension of the day. Also, I make sure to eat well and not skip meals. Those things really help, but they are so easy to slip away if I'm not careful.
Sounds like you really have some good strategies in place.
I do, although it didn't happen overnight. I remember stressful times years ago in previous jobs. I didn't always prepare myself for stress. I have really had to learn about what works for me and watch carefully that my plan doesn't slip away during major work changes.
Which brings me to, how about your team? What do you do to help them manage their stress?
Well, to go back to what you said about what is important about our work setting and our values and priorities, we have a team motto. We strive to work hard to provide the absolute best healthcare services to our patients and have fun doing it. It isn't always easy,